Hello, my name is Hughes Melton and I'm a family physician in Virginia. I've been working in Virginia for 25 years and I've worked in a number of different practice environments. One is in private practice in a rural area as well as in the military and working as an executive in a health system. And currently I work with the Virginia Department of Health. And the issue of burnout in my fellow family physicians is a significant issue. And in each practice location that I have worked, I found a number of things that I could do to help to avoid it. There are a lot of things that affect burnout, many of which we don't have a lot of control over. We can advocate and work with the American Academy of Family Physicians to attempt to change payment reform, issues with electronic medical records, those kinds of things. But I found there's some things that I actually have some control over, and I put those in sort of three categories I wanted to talk with you today. The first is time for reflection, or mindfulness, some people will call it. I was talking with our student leaders yesterday morning about often we live a very reactive life. We're very busy. The need around us is great. And sometimes that need can consume so much of our time that we spend all of our time and energy and effort reacting to that need. When in reality, in order to live a mindful life and to make the changes in our life that we want to make, we have to find some time for reflection. Often people find that time in the morning before the craziness of the day begins. And it's sort of a quiet time, if you would. Other people find it running. For me, it's a combination of exercise and then just some time reading in the morning, different types of reflective passages. So that's one thing that's worked for me. The second would be the people that you work with. And we have relative control over that, depending on our practice environment. But to the extent that you can work with those individuals, get to know them as people that you care about, and as a team that together you'll meet the need that comes into your clinic. And so taking that time to get to know them, when you're down, they can lift you up. That's probably the strongest factor that when I was in rural Southwest Virginia for 12 years, that enabled me to avoid burnout. And most days I came in with a joyful attitude, even if it was just to see my fellow coworkers. So to the extent that you can take the time to develop those kinds of working relationships with the nurses, with the front office, with the lab techs, and also of course your fellow providers, that's part of the antidote for burnout. The third would be to not become isolated, and partly that's getting to know your local team, but also become aware of the broader world of family medicine. For me, that was initially involvement in the Medical Society of Virginia, my state medical society. They had local chapters that I got involved with, but then also eventually the American Academy of Family Practice, and now I serve as the president for the American Academy of Family Physicians Foundation. And getting involved in that larger body of family medicine helps you understand, one, all the work that's being done to help address the issue of burnout and make being a family physician more fulfilling. And then also you can find kindred spirits that are outside of your local community that you can connect with. You can hear about ideas that you would never come up with on your own that can help you make positive changes in your own practice environment. So, those are three practical things that I think that family physicians can do to try and deal with the issue of burnout. First, find time for reflection, to be a little more mindful about your plans over the next week, 2 weeks, month. The second would be to get to know your fellow coworkers and try and develop a culture around you of caring for one another. And then the third would be to plug into the larger body of family medicine. There are a lot of resources that are out there that you can take advantage of. Different people need different types of resources in order to deal with the challenges that face them on a daily basis. And once you become aware of them, then you can take advantage of it. Appreciate you taking time to listen to me today, and wish you the best in your journey towards a fulfilling career as a family physician. Thank you.